set up the East Brighton Health Hub to try to solve the problem of patients ending up on waiting lists within our team. We're an outreach team, multidisciplinary, clinical and non-clinical staff. We also wanted to work more closely with the community in kind of providing healthcare and that working with local organisations. And we had an opportunity to use this space at Robert Lodge, which is just a housing estate in Whitehawk, and use their community space once a week to offer a drop-in.
We have a different offer because we recognise that not all people that sort of turn up at their GP practice needs to see a GP or a nurse. We're offering an open access drop-in style support for patients, and there's a range of healthcare services that you wouldn't see at your GP practice, and often you'd be waiting a long time via referral route to get into.
I think we see a lot of people who are not really sure what they need, but might be kind of struggling and feeling that life is overall a bit difficult. Often people will go to their GP with that kind of worry, but it isn't really actually a kind of GP thing. And the Health Hub means that people can just come straight to us. It's informal, it's a drop-in, it's local.
The main aim of the Health Hub is to provide open access to healthcare professionals for people that might not go to their GP practice, or might feel nervous or anxious, or might just find it too difficult to get a GP appointment.
I needed my ears checking, so they are duly checked, so I'm reassured. I'm quite phobic of hospital environment because of some adverse experiences. So for me, it's actually really important. I am autistic and I have post-traumatic stress. So being in a more neutral environment means that I can access it much more easily.
9 times out of 10, it's just about reassuring patients, or we signpost them on to other services, but that's very rare.
By bringing our services to the local community and embedding our services in the local community, I'd like to think that we are breaking down those barriers to healthcare, whether it's a waiting list or travelling or not knowing where to go. By just having that sort of real local offer is really important, and this is a particularly important place for that to happen.
We know historically that patients living in Whitehawk, their life expectancy is up to 20 years lower than people living in Hove, which is 5 minutes away. Have to get people much earlier because you don't have as much time to make a difference. Basically, it costs the NHS nothing to save itself tens of thousands of pounds later, especially if that patient doesn't engage.
Well, I come down about my hearing aid because I'd never used it. I'd had since November and I wasn't quite sure how to use it. Everyone was so helpful here. It was everything. I've got a doctor's appointment next week with my leg because it keeps giving out, and they were extremely helpful. I've only been here about an hour and I've had all that service done, it's been great.
Our reception team is amazing and they do such a good job of talking to people, figuring out everything that's going on, and then helping them identify what practitioner they might be able to see that day. And it can be up to 4 people. So they might think that they're coming in for one thing and then actually see other people as well.
So someone might come in with shoulder pain and specifically want to see a physio. Whilst they're speaking to the physio, it comes out that actually, their benefits have been stopped for a number of weeks, and as a consequence, they haven't been able to get the bus to go and see their family. What they can then do is see perhaps the welfare benefits advisor or a social prescriber will be able to kind of look into this with them, offer them that support.
Well, I've come for get a COVID. I'd rather speak to someone face to face, all that was ring here, ring there, not into it. You can just pop in, book in, so this is brilliant.
I think this is one of the best ideas that the area has had. They come down, they have the coffee, they see who they want to see, then might have another coffee, and then they go off. They've had contact. There's so many people, and so many people talk about it now, so it's a blooming good.
This is a fantastic service, and it's in exactly the right place, which is a location that they know, which they can easily access, which doesn't cost money to get to, and which is stable and always here. Is fantastic.
So we've had so far over 400 people come to the hub, and less than 10% of those people have received a referral back into the PCN team for extended support, which is really great, because what that tells us is kind of capturing the need when they come to visit the hub, rather than being added again, to a wait list to be seen by a team. And that's not to say that we can't offer that extended support. But the idea of this is to really kind of provide some answers, some clarity and some reassurance when people need it.
We brought health professionals right into the heart of the community. This is a safe space for the community, so people are able to come here and talk more in a more relaxed, open way about the health issues that are really affecting them.
Quite a lot of people come here and see our mental health support coordinator, and see a social prescriber, and see a nurse, and perhaps a little bit of all of those different issues is all getting looked at the same time. Might help people to cope a bit better with those kinds of combined challenges when there's lots of different things going on at the same time.